Hey guys, welcome back to my channel. The topic that we are going to discuss today is human health and disease. We have already read the chapter till AIDS, and the topic that we are going to cover in this video would be cancer, drug and alcohol abuse. So before we start the chapter, I would really like to thank you all. Thank you for being there. Thank you for always supporting because हमारे चैनल पे अब more than 300 सब्सक्राइबर्स हो गए. So ये जो भी कुछ पॉसिबल हुआ है, इट्स जस्ट बिकॉज ऑफ यू ऑल. आप मैंने भले ही कुछ भी एफर्ट्स डाले हों, लेकिन आप लोगों ने अप्रिशिएट किया, आप लोगों ने मेरे एफर्ट्स को रिकग्नाइज किया एंड मेरे चैनल को फॉलो किया. सो 300 plus subscribers just because of you all. So now we are 300 people strong. So thank you so much for being there. So without wasting any time, let's get started. Chapter 8, Human Health and Disease, Part 2. Cancer. Cancer is one of the most dreaded disease of human beings and is a major cause of death all over the globe. More than 1 million Indians suffer from cancer and a large number of them die from it annually. The mechanisms that underlie development of cancer or oncogenic transformation of cells, its treatment and control have been some of the most intense areas of research in biology and medicine. In our body, cell growth and differentiation is highly controlled and regulated. In cancer cell, there is breakdown of these regulatory mechanisms. Normal cells show a property called contact inhibition, by virtue of which contact with other cell inhibits their uncontrolled growth. Cancer cell appears to have lost this property. As a result of this, cancerous cells just continue to divide, giving rise to masses of cells called tumors. Tumors are of two types: benign and malignant. Benign tumors normally remain confined to the original location and do not spread to other parts of the body and cause little damage. The malignant tumors, on the other hand, are a mass of proliferating cell called neoplastic or tumor cells. These cells grow very rapidly, invading and damaging the surrounding normal tissues. As these cells actively divide and grow, they also starve the normal cells by competing for vital nutrients. Cells sloughed from such tumors reach distant sites through blood and wherever they get lodged in the body, they start a new tumor there. This property, called metastasis, is the most feared property of the malignant tumors. Causes of cancer. Transformation of normal cells into cancerous neoplastic cells may be induced by physical, chemical, or biological agents. These agents are called carcinogens. Ionizing radiations like X rays and gamma rays and non ionizing radiation like UV cause DNA damage, leading to neoplastic transformation. The chemical carcinogens present in tobacco smoke have identified as a major cause of lung cancer. Cancer causing viruses called oncogenic viruses have genes called viral oncogenes. Furthermore, several genes called cellular oncogenes, C-onc, or proto-oncogenes have been identified in normal cells, which, when activated under certain conditions, could lead to oncogenic transformation of the cells. Cancer detection and diagnosis. Early detection of cancer is essential as it allows the disease to be treated successfully in many cases. Cancer detection is based on biopsy and histopathological studies of the tissue and blood and bone marrow test for increased cell count in the case of leukemias. In biopsy, a piece of suspected tissue cut into thin sections is stained and examined under microscope, histopathological studies by a pathologist. Techniques like radiography, use of X rays, CT, computed tomography, and MRI, magnetic resonance imaging, are very useful to detect cancer of the internal organs. Computed tomography uses X rays to generate a three-dimensional image of the internals of an object. MRI uses strong magnetic fields and non ionizing radiation to accurately detect pathological and physiological changes in the living tissue. Antibodies against cancer specific antigens are also used for detection of certain cancers. Techniques of molecular biology can be applied to detect gene in individual with inherited susceptibility to certain cancers. Identification of such genes which predispose an individual to certain cancer may be very helpful in prevention of cancers. Such individual may be advised to avoid exposure to particular carcinogens to which they are susceptible. Example, tobacco smoke in case of lung cancer. Treatment of cancer. The common approaches for treatment of cancer are surgery, radiation, therapy, and immunotherapy. In radiotherapy, tumor cells are irradiated lethally, taking proper care of the normal tissues surrounding the tumor mass. Several chemotherapeutic drugs are used to kill cancerous cells. Some of these are specific for particular tumors. Majority of drugs have side effects like hair loss, anemia, etc. Most cancers are treated by combination of surgery, radiotherapy, and chemotherapy. Tumor cells have been shown to avoid detection and destruction by immune system. Therefore, the patients are given substances called biological response modifiers such as alpha interferon, which activates the immune system and helps in destroying the tumor. Drugs and alcohol abuse. Surveys and statistics show that use of drug and alcohol has been on the rise, especially among the youth. This is really a cause of concern as it could result in many harmful effects. Proper education and guidance would enable youth to safeguard themselves against these dangerous behavior patterns and follow healthy lifestyle. The drugs which are commonly abused are opioids, cannabinoids, and coca alkaloids. Majority of these are obtained from flowering plants. Some are obtained from fungi. Opioids are the drugs which bind to specific opioid receptors present in our central nervous system and gastrointestinal tract. Heroin, commonly called smack, is chemically diacetylmorphine, which is a white, odorless, bitter crystalline compound. This is obtained by acetylation of morphine, which is extracted from the latex of poppy plant Papaver somniferum. Generally taken by snorting and injection, heroin is a depressant and slows down body functions. Cannabinoids are a group of chemicals which interact with cannabinoid receptors present principally in the brain. Naturally, cannabinoids are obtained from the inflorescence of the plant Cannabis sativa. The flower tops, leaves, and the resin of cannabis plant are used in various combinations to produce marijuana, hashish, charas, and ganja. Generally taken by inhalation and oral ingestion. These are known for their effects on cardiovascular system of the body. Coca alkaloid or cocaine is obtained from coca plant Erythroxylum coca, native to South America. It interferes with the transport of neurotransmitter dopamine. Cocaine, commonly called coke or crack, is usually snorted. It has a potent stimulating action on central nervous system, producing a sense of euphoria and increased energy. Excessive dosage of cocaine causes hallucination. Other well-known plants with hallucinogenic properties are Atropa belladonna and Datura. These days, cannabinoids are also being abused by some sports persons. Drugs like barbiturates, amphetamines, benzodiazepines, and other similar drugs that are normally used as medicines to help patients cope with mental illness like depression and insomnia are often abused. Morphine is a very effective sedative and a painkiller and is very useful in patients who have undergone surgery. Several plants, fruits, and seeds having hallucinogenic properties have been used for hundreds of years in folk medicine, religious ceremonies, and rituals all over the globe. When these are taken for a purpose other than medicinal use or in amounts or frequency that impairs one's physiological, or psychological functions, it constitutes drug abuse. Smoking also paves the way to hard drugs. Tobacco has been used by human beings for more than 400 years. It is smoked, chewed, or used as a snuff. Tobacco contains a large number of chemical substances, including nicotine and alkaloid. Nicotine stimulates adrenal gland to release adrenaline and noradrenaline into blood circulation, both of which raise blood pressure and increase heart rate. Smoking is associated with increased incidence of of cancers of lung, urinary bladder and throat, bronchitis, emphysema, coronary heart disease, gastric ulcer, etc. Tobacco chewing is associated with increased risk of cancer of the oral cavity. Smoking increases carbon monoxide content in blood and reduces the concentration of heme bound oxygen. This causes oxygen deficiency in the body. When one buys packet of cigarette, one cannot miss the saturatory warning that is present on the packing which warns against smoking and says how it is injurious to health. Yet, smoking is very prevalent in the society, both among young and old. Knowing the dangers of smoking and chewing tobacco and its addictive nature, the youth and old need to avoid these habits. Any addict requires counseling and medical help to get rid of the habit. Adolescence and drug or alcohol abuse. Adolescence means both a period and a process during which a child becomes mature in terms of his or her attitudes and beliefs for effective participation in the society. The period between 12 to 18 years of age may be thought of as adolescence period. In other words, adolescence is a bridge linking childhood and adulthood. Adolescence is accompanied by several biological and behavioral changes. Adolescence, thus, is a very vulnerable phase of mental and psychological development of an individual. Curiosity, need for adventure and excitement, and experimentation constitute common causes which motivate youngsters toward drug and alcohol use. A child's natural curiosity motivates him or her to experiment. This is complicated further by effects that might be perceived as benefits of alcohol or drug use. Thus, the first use of drugs or alcohol may be out of curiosity or experimentation, but later the child starts using these to escape facing problems. Of late, stress from pressures to excel in academics or examination has played a significant role in persuading the youngsters to try alcohol and drugs. The perception among youth that it is cool or progressive to smoke, use drugs or alcohol is also in a way a major cause for you to start these habits. Television, movies, newspapers, internet also help to promote this perception. Other factors that have been seen to be associated with drug and alcohol abuse among adolescents are unstable or unsupportive family structures and peer pressure. Addiction and dependence. Because of the perceived benefits, drugs are frequently used repeatedly. The most important thing which one fails to realize is the inherent addictive nature of alcohol and drugs. Addiction is a psychological attachment to certain effects, such as euphoria and a temporary feeling of well being associated with drugs and alcohol. These drive people to take them even when these are not needed, or even when their use becomes self destructive. With repeated use of drugs, the tolerance level of the receptors present in our body increases. Consequently, the receptors respond only to higher doses of drugs or alcohol, leading to greater intake and addiction. However, it should be clearly borne in mind that use of these drugs even once can be a forerunner to addiction. Thus, the addictive potential of drugs and alcohol pull the user into a vicious circle leading to their regular use, that is abuse, from which he or she may not be able to get out. In the absence of any guidance or counseling, the person gets addicted and becomes dependent on their use. Dependence is the tendency of the body to manifest a characteristic and unpleasant withdrawal syndrome if regular dose of drugs or alcohol is abruptly discontinued. This is characterized by anxiety, shakiness, nausea, and sweating, which may be relieved when use is resumed again. In some cases, withdrawal symptoms can be severe and even life threatening, and the person may need medical supervision. Dependence leads the patient to ignore all social norms in order to get sufficient funds to satiate his or her needs. These result in many social adjustment problems. Effects of drug or alcohol abuse. The immediate adverse effect of drugs and alcohol abuse are manifested in the form of reckless behavior, vandalism, and violence. Excessive doses of drugs may lead to coma and death due to respiratory failure, heart failure, or cerebral hemorrhage. A combination of drugs or their intake along with alcohol generally results in overdosing and even deaths. The most common warning signs of drug and alcohol abuse among youth include drop in academic performance, unexplained absence from school or college, lack of interest in personal hygiene, withdrawal, isolation, depression, fatigue, aggressive and rebellious behavior, deteriorating relationships with family and friends, loss of interest in hobbies, change in sleeping and eating habits, fluctuations in weight, appetite, etc. There may be even be some far-reaching implication of drug or alcohol abuse. If an abuser is unable to get money to buy drugs or alcohol, he or she may turn to stealing. The adverse effects are just not restricted to the person who is using drugs or alcohol. At times, a drug or alcohol addict becomes the cause of mental and financial distress to his or her entire family and friends. Those who take drugs intravenously, direct injection into the vein using a needle and syringe, are much more likely to acquire serious infections like AIDS and hepatitis B. The viruses which are responsible for these diseases are transferred from one person to another by sharing of infected needles and syringes. Both AIDS and hepatitis B infections are chronic infections and ultimately fatal. Both can be transmitted through sexual contact or infected blood. The use of alcohol during adolescence may also have long term effects. It could lead to heavy drinking in adulthood. The chronic use of drugs and alcohol damages nervous system and liver cirrhosis. The use of drugs and alcohol during pregnancy is also known to adversely affect the fetus. Another misuse of drug is what certain sports persons do to enhance their performance. The misuse narcotic analgesics, anabolic steroids, diuretics, and certain hormones in sports to increase muscle strength and bulk and to promote aggressiveness and as a result increase athletic performance. The side effects of the use of anabolic steroids in female includes masculinizations, features like male, increased aggressiveness, mood swings, depression, abnormal menstrual cycles, excessive hair growth on face and body, enlargement of clitoris, deepening of voice. In male, it includes acne, increased aggressiveness, mood swings, depression, reduction of size of the testicles, decreased sperm production, potential for kidney and liver dysfunction, breast enlargement, premature baldness, enlargement of the prostate gland. These effects may be permanent with prolonged use. In the adolescent male or female, severe facial and body acne and premature closure of the growth centers of the long bones may result in stunted growth. Prevention and control. The age old the age old adage of prevention is better than cure holds true here also. It is also true that habits such as smoking, taking drug or alcohol are more likely to be taken up at a young age, more during adolescence. Hence, it is best to identify the situation that may push an adolescent towards use of drugs or alcohol and to take remedial measures well in time. In this regard, the parents and the teachers have a special responsibility. Parenting that combines with high levels of nurturance and consistent discipline has been associated with lowered risk of substance of alcohol or drugs or tobacco abuse. Some of the measures mentioned here would be particularly useful for prevention and control of alcohols and drug abuse among adolescents. First, avoid undue peer pressure. Every child has his or her own choice and personality, which should be respected and nurtured. A child should not be pushed unduly to perform beyond his or her threshold limits, be it studies, sports, or other activities. Second, education and counseling. Educating and counseling him or her to face problems and stresses and to accept disappointments and failures as a part of life. It would also be worthwhile to channelize the child's energy into healthy pursuits like sports, reading, music, yoga, and other extracurricular activities. Third, seeking help from parents and peers. Help from parents and peers should be sought immediately so that they can guide appropriately. Help may even be sought from close and trusted friends. Besides getting proper advice to sort out their problems, this would help young to vent their feeling of anxiety and guilt. Fourth, looking for danger signs. Alert parents and teachers need to look for and identify the danger signs discussed above. Even friends, if they find someone using drugs or alcohol, should not hesitate to bring this to the notice of parents or teachers in the best interest of the person concerned. Appropriate measures would then be required to diagnose the malady and the underlying causes. This would help in initiating proper remedial steps or treatment. Fifth, seeking professional and medical help. A lot of help is available in the form of highly qualified psychologists, psychiatrists, and de-addiction and rehabilitation programs to help individuals who have unfortunately got into the quagmire of drug or alcohol abuse. With such help, the affected individual with sufficient efforts and willpower can get rid of the problem completely and lead a perfectly normal and healthy life. Summary. Health is not just the absence of disease, it is a state of complete physical, mental, social, and psychological well being. Diseases like typhoid, cholera, pneumonia, fungal infections of skin, malaria, and many others are a major cause of distress to human beings. Vector borne diseases like malaria, especially one caused by Plasmodium falciparum, if not treated, may prove fatal. Besides personal cleanliness and hygiene, public health measures like proper disposal of waste, decontamination of drinking water, control of vectors like mosquito, and immunization are very helpful in preventing these diseases. Our immune system plays the major role in preventing these diseases. When we are exposed to disease causing agents, the innate defenses of our body, like skin, mucous membrane, antimicrobial substance present in our tears, saliva, and the phagocytic cells help to block the entry of pathogens into our body. If the pathogens succeed in gaining entry to our body, specific antibodies or humoral immune response and cell mediated immune response serve to kill these pathogens. Immune system has memory. On subsequent exposure to some pathogen, the immune response is rapid and more intense. This forms the basis of afforded by afforded by vaccination and immunization. Among other diseases, AIDS and cancer kill a large number of individuals worldwide. AIDS caused by the human immunodeficiency virus HIV is fatal but can be prevented if certain precautions are taken. Many cancers are curable if detected early and appropriate therapeutic measures are taken. Of late, drug and alcohol abuse among youth and adolescents is becoming another cause of concern. Because of the addictive nature of alcohol and drugs and their perceived benefits like relief from stress, a person may try taking these in the face of peer pressure, examination related, and competition related stresses. In doing so, he or she may get addicted to them. Education about their harmful effects, counseling, and seeking immediate professional and medical help would totally relieve the individual from these evils. So here we completed the entire chapter human health and disease. I hope you enjoyed listening the audio. So if you liked it, please hit the like button. Please subscribe to my channel and comment down if you have any doubts or if you want anything from my side. Till then, keep studying. Bye bye. Thank you so much for watching my video.